Hello, this is Dr. Kevin Connors again. We are going to be talking about chronic Lyme disease and Lyme disease in general in these first few presentations. I'm going to break this up into multiple presentations. This is going to be kind of an overview for anybody that already has Lyme, but I think it'll be a helpful overview on how we look at Lyme disease here in our office. And then we will get into some very deep discussions in further presentations on current research that's out there that I will try to break down for you and give you the skinny on some new possibilities for dealing with chronic Lyme disease. If you haven't read my book or download my book, please do so. It would be helpful, as well as any other books that you might be interested in. All right, so it's obviously an unconventional disease. The history, real briefly, stems back from the 1970s when some people in the little town of Lyme, Connecticut, hence the name Lyme disease, were starting to suffer some strange symptoms. They did not know what caused it, and that's where we got the name Lyme disease. Now, there's a lot of different theories that surround this, and we're going to go deeper in these in further discussions. One major theory that most people that struggle with Lyme disease may hold on to is that the theory of Plum Island. Now, Plum Island is a little island owned by the United States Department of Agriculture now, but it was run by the U.S. Department of Defense during the Cold War. It's right off of Lyme, Connecticut. And some of the theories are that during the Cold War, there was experimentation with germ warfare at that facility. Now, it is well known that the United States Department of Defense was experimenting with germ warfare throughout the U.S. They were doing different studies. They were trying to create and did create a cancer virus. And that's a whole discussion in itself. But the theory goes that they created a bacteria from morphine and other bacteria, and they were going to use possibly a tick at that time as an intermediate host. And the thought was that they could fly over a country, drop all these ticks that would then affect the people, and people would die. Now, I don't really fully understand what was going through the minds of our leadership in this country when you're talking about germ warfare, because if you're going to create a disease that's going to kill millions and millions of people and bring your enemy to their knees, was there thought that, we could just inoculate our people with the vaccination, that they're going to be immune to that disease, so none of our people are going to die, but all their people are going to die? It's insanity. So, but this, we have to understand the culture of the Cold War. There was such unbelievable fear that the U.S. was going to be nuked by Russia and vice versa. So we kind of got to give them a little understanding of the fear that was involved. Now, the U.S. certainly was not the only country that was experimenting with crazy different ways to kill human beings during that time. Russia was at the same time. So we'll go more into that, into the theories of how Lyme disease started, and some more in-depth presentations in the future. But I just wanted to kind of give you an overview. It was in the 1980s that this scientist really named the Borrelia burgdorferi. He was the one who discovered it, and it was named after him. We now know that there's dozens and dozens and dozens of co-infections that go along with that. So when a person has this type of gram-negative bacteria, there's other things that they also have that go along with that. In the early 2000s, that's when at least the CDC started to recognize it. For years, they were just basically brushing it under the rug and pretending that it didn't even exist. Even to this day, they still fail to recognize chronic Lyme disease, which which in itself, for as I look at different the kind of conspiracy theory origins of Lyme disease, it makes me start to believe that they may be true, given the fact that the CDC is totally willing, and so is every pharmaceutical company, is willing to jump on a new disease that they could make money off of. Matter of fact, you can't listen to a commercial on television, a pharmaceutical commercial, where they're making up a new disease constantly, and because they have a new drug for it. Why wouldn't they jump on Lyme disease? There has to be some political connection where maybe if they did jump on chronic Lyme disease, there'd have to be a greater investigation into the cause, and it would be it wouldn't be a good thing if everybody really knew where it came from. I don't know. Maybe it was they're protecting lawsuits. I have no idea. It just seems very strange that doctors are being persecuted for treating chronic Lyme disease, and states have to have citizens, bring petitions to their lawmakers to give doctors a freedom of rights to treat chronic Lyme disease. It just makes no sense to me. So there's something political behind the scenes, hush hush about the whole thing. It's just it's a very sad situation for a lot of Lyme sufferers, especially when you're dealing with acute Lyme. And I have patients that call me all the time. What should I do? Get some antibiotics? My doctor won't give me any antibiotics because the test came back negative, even though I had this huge bullseye rash and I have these flu symptoms. It's insanity. It's absolute insanity. How few doctors know anything about Lyme disease, and how their the the clinics and the hospitals are basically telling the doctors that it doesn't exist. There's something political going on. Today, it is one of the fastest growing vector borne infections in the United States. The CDC estimates that there are over 300,000 new cases each year in the U.S. Now, if so few of them are being diagnosed, and they're saying 300,000, that's a scary number that's really possible out there. It could be in the millions of people that are being infected with Lyme disease every year. It is it is not, you look at some maps. I didn't post any on this presentation, but Lyme disease really started in the eastern country. Now it's literally in every state. According to the recent research, not yet in Hawaii, but there's probably Lyme cases in Hawaii now. It is it's insane how fast it's spreading. If in fact the government did produce this bacteria in experimentation, it is one sad situation, and understandably why they'd want to cover it up. So why is it such a problem treating Lyme? The biggest thing is that Lyme hides. So Lyme disease, the Borrelia burgdorferi bacteria, is a gram-negative bacteria. Now, if you listen to any of my other talks, we talk about different types of bacteria. They're gram-positive and gram-negative bacteria. Gram-negative bacteria, there's other classifications, but this gram-negative bacteria is different than other bacteria on how the cell membrane is made up. Gram-negative bacteria have what's called a lipopolysaccharide in the cell membrane. Gram-negative bacteria also have the ability, not all of them, but some of them have the ability to go inside of a cell and hide inside the cell. Now, this makes it very unique. Viruses go inside the cell. That's how they replicate. Typically, bacteria do not go inside the cell. So when you give somebody an antibiotic, you're able to eradicate the bacteria. When you give somebody an antibiotic that has a virus, you're not able to eradicate the virus. Antibiotics do nothing against virus. Viruses are hiding inside the cell. That's how they live. They don't just live in the bloodstream of the host, they go intracellular. So it is with some of the gram-negative bacteria, Lyme being one of them. It has the ability to infiltrate the cell and hide inside the cell. If it hides inside the cell, then your immune system can't kill it because it's inside the cell, and your an antibiotic can't kill it. So you have to catch it while it's still extracellular, while it's still in the bloodstream, if you're going to kill it with antibiotic. Now, normally, if a virus infiltrates the cell actually puts up a marker on the outside of the cell telling your immune system that it has been invaded. So when the immune system sees this marker outside the cell, the immune system will actually engulf that cell and destroy that entire cell, killing the virus inside the cell as well so it can't replicate. That's how your body kills viruses. Now, if a cell has been infiltrated, that marker should, it's a little protein marker that the cell gives off so that the immune system can tell that it's been invaded. Lyme disease has the ability to disable that marker. So now the Borrelia bacteria is inside the cell and the immune system doesn't know it. So the immune system can't find it, can't kill it. It's looking for this enemy that was located in this area, and now it's got circulating immune cells trying to kill this bacteria, and it can't find it. Well, you're going to learn when we get to understand what stage 3 autoimmune Lyme disease is. That can be a huge problem because my immune system is like the U.S. Marine Corps. They are not going to give up until they find that antigen, that enemy. And they will actually start creating enemies out of their own self tissue if they can't find the enemy. And that's when the person has very, very debilitating symptoms. So we'll get to that, so just hold on. But the biggest problem with treating Lyme is that Lyme hides intracellular. This is kind of a neat little slide. There's some studies done on root canals. So root canals were tested for Borrelia. Now, if you I have a whole presentation on the negative things about root canals. But the problem with a root canal is that a root canal in itself, you have this dying tooth that is super painful because it's infected. So the purpose of a root canal is we're going to drill through the tooth, get to the core of the tooth. We're going to dig out the blood supply and the nerve supply and then fill it in and pack it in with whatever filling we're going to put in there. And now you still have this pretty tooth that you can chew things with, but it's a completely dead tooth. Now, if you looked, well, you think that's a good thing. Great, now I don't have any pain anymore. Now I still have my tooth. I don't have a hole in my gum, and life goes on. But the problem is, a tooth is a porous material. If we could take a tooth and put it under a microscope, it has all these little pores inside there. It's actually a living organism, your tooth is. It's a part of your body, similar to bone. Just because it's dense doesn't mean it's not living. So a tooth is a living thing, and you took out the blood supply, you took out the nerve supply, and now basically you have a hotel for bacteria. So bacteria can stay in that root canal tooth, live in that tooth, even if you took a lot of antibiotics, even if you smeared antibiotics on that tooth, and you took a whole bunch of herbals, and you did all the things right, they can't penetrate the tooth because there's no blood supply to the tooth left. You did a root canal on it and removed it all. So bacteria can house in that tooth. So as soon as your immune system drops down a little bit, they go out of the tooth, start replicating, they start infecting your body, then your immune system kicks on to kill it, and the ones that are still in the tooth are still hiding in the tooth. So, it's a nasty thing. So a root canal can be the cause of a person's chronic infection. Now, when I say cause, it's not really the cause, it's the hotel that the chronic infection can hide in and live there. So as soon as your immune system drops a little bit, they take off, and it makes you really sick. You fire an immune response. You might kill off the stuff that's in the blood. If you have a healthy immune system, you continue to do that, continue to do that, continue to do that, and all sorts of bad things can happen, one being an autoimmune disease too. Second reason why it's hard to treat is that few people understand the Lyme stages. Few doctors that you go to understand any stages of Lyme disease. They'll take a patient that has Lyme symptoms going on for 5 or 6 months, and they'll put them on antibiotics. Well, doxycycline is going to do very little for a person's Lyme symptoms after they're beyond that acute stage. It will help their symptoms for a short period of time because it will kill anything that is extracellular, but it's not going to do anything for the spirochetes that are intracellular within the cell. And so while they're taking the antibiotic, they feel a little bit better, possibly, and as soon as they go off, their symptoms start to come back because you can't kill the bacteria that's inside the cell. So if you don't understand the different stages of Lyme disease, it makes it more difficult to treat. And last, fewer still understand that the third stage that I speak about. I know there's a lot of writing about Lyme disease, so what you're going to hear from me is going to be different. So there's writing about Lyme disease that talks about 2 stages or talks about 3 stages. You're going to get over and over again what my definition of the 3 stages or 3 phases of Lyme disease are. The third phase in my book is it's moved to an autoimmune disease. So I'm going to hit that hard and heavy. What an autoimmune disease is. It is your immune system attacking your self-tissue because it was looking for the antigen. Remember, an antigen in an immune response is anything that the immune system is turned on against. In this case, the Borrelia and its co-infections, and now it's attacking self-tissue. So we'll get into that in depth, so hold your horses and we'll talk about that. Take home from this is that treat acute Lyme disease as soon as possible with antibiotics. We're going to talk more about that with the next presentation that you'll get next week. And if you do not get fairly instantaneous relief of your fever, chills, rash, etc. by taking antibiotics, you probably missed the window. So you can always call our office for help. Remember, if you have questions, we see people from all over the world with Lyme disease and cancer, so we're always here to help. All right, I hope this helped. We're going to be going deeper and deeper as we go. If this is all new to you, listen to it again, and we'll talk to you soon. Bye-bye.